Okay, so the topic we study today will be periodontal diseases. Okay, so periodontal diseases, let's start. So what are periodontal diseases? A chronic bacterial infection. It is chronic and it is bacteria. Okay, a chronic bacterial infection that affects the gums and bones supporting the teeth. Now, if you remember periodontium, what was the structure of periodontium and what were the tissues in that? Let's just first go to that part. As all of you remember, the periodontium contained four tissues, periodontal tissues, which we have named, which we have had a mnemonic gaps. These were the gaps: G for gingiva, A for alveolar bone, P for periodontal ligament, and C for cementum. The details of these we have already studied in our oral diagnosis and oral anatomy previous slides, basically. So we will not go into the details of these. What are these structures, if they are hard tissues, if they are soft tissues, and what are their functions, what is their histology. But right now we will study it as a pathological state, as a disease in this slide. So you already know the anatomy, the histology of these, the physiology of these, the function of these. I have some idea. So we'll go for the disease of the periodontium, or the tissues involved here. So it's a chronic bacterial infection that affects the gum and the alveolar bone, basically the four or periodontal tissues. So it's a chronic bacterial infection. Okay. Periodontal diseases range from simple gum inflammation. Gum inflammation will be gingivitis, to serious disease that results in major damage to the soft tissues and the bony structure that support gingivitis, and it can reach to a serious major damaging stage where all the soft tissue and bone will be involved. And if it is not taken care of, then finally the tooth will lose its vessel, the tooth will lose its arterial supply, blood supply, and will fall. So that's why it's important. Chunali. Okay, so periodontal disease is an infectious process that involves the structure of periodontium. We know that. Okay, periodontal disease can cause a breakdown of the periodontium, resulting in loss of tissue attachment and destruction of the alveolar bone. Let me just, okay, okay, here we can see. So periodontal disease, infectious process, as we know, bacteria is involved, that involves the structure of periodontium. We know the structure, the gum, and the supporting structure, supporting teeth. These are the four tissues known as periodontium. Periodontal diseases can cause a breakdown of these periodontium, the structure, resulting in loss of tissue attachment, means the teeth to the alveolar bone, and the destruction of the alveolar bone, which will lead to the loss of tooth. And in the end, periodontal diseases are the leading cause of tooth loss in adults. So that's why it's important to know what are the periodontal diseases. Okay, so again, the structure of periodontium. Periodontium has four tissues. We have named mnemonic as gaps, gingiva, along with junction epithelium and gingival sulcus, alveolar bone, periodontal ligament, and cementum. On the right side, we can see the tissues of periodontium. From here, gingiva, also known as gums as a layman term. The medical term is gingiva or gingiva, whatever you want to say, however you want to prefer, it's okay. And then we have A, alveolar bone, the socket for the teeth. And then we have periodontal ligament between the teeth and the alveolar bone. And then there is cementum, is a layer. towards the dentin. So this is the structure of periodontium, a revision. And again, a histological, a zoom structure where you can see the free gingiva, the attached gingiva, and alveolar mucosa. So here you can see we have a gingival sulcus. That is important. This sulcus. And then there is an epithelium. You remember we said gingiva along with the surface epithelium and the gingival sulcus. So these were we talking about. And then free gingival groove, gingival fibers, mucogingival junction, where there is alveolar mucosa and gingiva are attaching. This junction is known as mucogingival junction. And this is alveolar bone, again cementum, the layer, junctional epithelium. This junctional epithelium is between the cementum. This makes an angle between the sulcus, gingival sulcus, sulcal epithelium, and cementum. This junction is also known as cemento-enamel junction, and this is the junctional epithelium. This is dentin and enamel. As you know, outermost is enamel, and then next to them is dentin. Enamel ends at the end of the or the lower angle of the gingival sulcus, where cementum starts along with the dentin. On the right side, this gingiva has been zoomed so that you can see the tooth surface, basically the enamel, the dentin, the sulcus, gingival sulcus, junctional epithelium, making a junction known as cemento enamel junction, and then cementum and periodontal ligament. Perfect. So this is a review for the structure of periodontium. So now we see what are the characteristics of periodontal diseases. Onset, it can be at any age, at any stage, but most common is adults. We have seen this is the one of the most common disease of the adults. Okay. How it starts? It starts when a person does not take care of the oral hygiene and plaque starts developing on the teeth enamel outside, outer layer. And this initiates the formation of plaque formation, initiates periodontal disease. So one is subgingival calculus. So when it is near the gingiva, the plaque formation make an appearance known as calculus, which is one of the common finding of the initiation of periodontal diseases. It usually has a slow progress, but periods of rapid progression are possible. In the case of immunocompromised or with a person having a comorbidity like CVS, cardiovascular diseases, obesity, type 2 mellitus, which is also known as, it's also immunocompromised state, the periods will be rapid progression. There will be rapid progression of periodontal disease. Otherwise, there is slow progression. What do you mean by progression? Here we can see on the right side, we have a healthy tooth or gum. Then there is inflammation of gum inflammation and bleeding, plaque buildup. This will let bacteria create a plaque buildup and inflame the gum tissue. This is known as gingivitis. So from the healthy tissue, we have reached to a state known as gingivitis, where gum inflammation and bleeding can be seen, and plaque development can be seen. So this is the initiation of the periodontal disease. And then we go to the periodontitis, where plaques hardens into calculus. So plaque deposition is not being taken care of. And this plaque, which was once easy to remove, now it has hardened. It has changed into a hard substance known as calculus. And there's pockets are formed. You see the empty spaces, the gaps. Excuse me. This is pockets. Pockets form around teeth and bone loss begins. Now the bone loss is beginning. And then this periodontal, when the pockets deepen and there is more bone loss, the bony structure, advanced bone loss and tissue damage will be there. Less calcium, you know, the mineralization has removed deep pockets. This will be known as advanced periodontitis. There will be significant bone loss and deep pockets. So this is, we mean the progression of that disease. So this is, so usually it is slow progression, but in the case of comorbidity, or in the case of immunocompromised patient like diabetes, or we have leukemia, the disease will progress rapidly. This is modified by local factors, systemic factors, stress, and smoking. So these are some risk factors which will decide either once it has started, it will go slowly or fastly. If you are not taking care of the systemic factors like diseases, diabetes, and this obesity, increase LDL, and then you're taking stress, smoking is there, you are not removing plaque. So these diseases will be easily progressed to the stage where there will be periodontitis and advanced periodontitis, and you can lose your tooth. Okay, so these were the characteristics of periodontal disease: how it starts, when it starts, how it progresses, and what are the factors modifying this disease. Okay, let's move to the next slide. So as we know, this is a chronic disease and is infective, so caused by bacteria. So we must know some important bacteria, gram-positive and gram-negative bacteria, to do this, right? So what are the important bacteria causing periodontal disease or disease of periodontium? Three important genera of gram-positive bacteria. Three important genera: ALS, Actinomyces, Lactobacillus, Streptococci. How to remember? You will remember ALS. And then all of them are facultative. As you know, few bacteria are facultative. Among gram-positive, Actinomyces, Lactobacillus, and Streptococci are facultative anaerobes. Facultative anaerobes mean, anyone from the class, what do you mean by facultative anaerobes? One of them is obligatory and one is facultative. How to differentiate? If no one is saying, then I'll just say.
Sir,
Yes, please.
Sir, it can grow in both aerobic and anaerobic conditions.
Perfect.
Production of
in the presence of oxygen or absence of oxygen.
like say
Okay, perfect. Yes, please.
Like say the production, like say in simple terms, we can say that it can do the production of ATP both in the presence of oxygen and in the absence of oxygen both.
Yes. So when there is facultative, it means they have a choice. There's not other term is obligatory. Obligatory means obligation. It's the utmost duty of the bacteria to grow in that environment. If that environment is not provided, obligatory bacteria cannot survive. But facultative are like facilitative, like they have an option. So they are anaerobes. They love absence of oxygen. These bacteria are anaerobes. They love absence of oxygen. If no oxygen, they will grow best. But facultative means even if there is presence of oxygen, still they will grow. So in our mouth, usually anaerobes are a lot in number than aerobes. So when we open our mouth, the mouth cavity fills with oxygen, still they have to survive. So that's why they are facultative. The facultative means, first we need to see this term. This is anaerobe. Anaerobe means it can survive, it must survive in the absence of oxygen, but it is not obligatory, it is facultative. It means it has option. So even in the aerobic condition, even in the presence of oxygen, it will also grow and survive. Okay, so lactobacillus, as we remember, lacto is lactic acid. So that's how you remember. What I want you to remember is all the gram-positive bacteria are facultative anaerobes. Facultative anaerobes. One you understand, one you remember, right? The other thing is lactobacillus, lactic and lactic acid, and strepto also produce lactic acid in the mouth. So two things you already remember. Three things: ALS, Actinomyces, Lactobacillus, Streptococci, and then facultative anaerobe. All of them are facultative anaerobe, but Lactobacillus and Streptococci also produce lactic acid in the mouth. That's important. And which one has lacto is basically involved in dentin. Okay. Now, streptococci, we have 4 species involved in this. Strep mutans, Streptococcus salivarius, saliva, angiosis or mitis. Okay, as you remember, mutants and mitis are also involved in the bacterial endocarditis, and we have a disease, okay, which start from the mouth pharyngitis and cause bacterial endocarditis. So how do you remember is mutants, mites cause endocarditis. Mutants, mites cause endocarditis. This is a mnemonic, okay? Okay, let me just write it here. Mutants, mites causes endocarditis. Okay, so this is how you remember 2 of the species of streptococci, which also cause bacterial endocarditis and also are the gram-positive bacteria involved in the periodontal disease. Saliva, salivarius, is related to saliva, like its name has saliva in it, right? So it should be in the tongue, right? And then other is angiosis or angiosis. Angiosis is better. And then it is isolated dental plaques and mucosal surface. So now what we do is we just write it down. Okay, so what we know is bacterial endocarditis, right? So let green it, and this is how we remember these 2. Okay, mutants and mitans, we know endocarditis. Mutants, mites causes endocarditis. Mutants, mites, endocarditis. Okay, saliva. Yes, salivarius, saliva. Saliva is in the tongue. Oh, this is not a good color, I think. Oh, let's just change to blue. Okay, blue. So tongue. Okay, that's good. We have a connection. We have a way to remember these. Okay, so mutants, mites causes endocarditis, also cause periodontal disease. Salivarius cause tongue. So if even in the viva you reproduce at least 3 of them, and I say, okay, gram-positive bacteria, you remember ALS, you remember mutant mites, you got the full marks. Perfect. Okay, so now you have some idea of this. Now the gram-negative bacteria. What are the gram-negative bacteria involved in causing periodontal disease? These are the most important gram-negative bacteria involved include Porphyromonas, Pseudomonas, Porphyromonas. Porphyromonas gingivalis is the major periodontal pathogen. And the other one is Treponema. This group is important in acute periodontal conditions known as ANUG, acute necrotizing ulcerative gingivitis. And the third important is Actinobacillus, associated with aggressive, A for aggressive periodontitis. Okay, now we also do this. So we change into red. That's how I remember this. I'm doing this in front of you so that you can remember how I used to remember the difficult part or the cramming part. Make mnemonics easy. Okay. Oh, sorry. So I think I have found this, like this, and like this. This is how I used to remember, and I want you to adopt this habit and adopt in your life. Okay. And then we have Treponema. This group is important in causing acute. Okay, Treponema cause ANUG, acute necrotizing ulcerative gingivitis. This is very necrotizing, ulcerative. This is very, very, very difficult, very, very bad looking. That's how you can remember that acute necrotizing gingivitis. Perfect. Okay, so now we save it and we go back. So bacteria involved, gram-negative bacteria. The most important gram-negative bacteria involved include P for periodontal pathogen. This is the major. So Porphyromonas gingivalis, major periodontal pathogen. And then we have Periodontal, intermedia, Fusobacterium nucleatum, Actinobacillus associated with aggressive periodontitis, AAA, PPP. Okay, then Treponema. This group is important in causing acute periodontal condition, acute and severe, acute necrotizing ulcerative gingivitis, ANUG. Then Neisseria and Bellonella. I want you to at least remember Porphyromonas, Actinobacillus, Treponema, and what they cause. If you name others, perfect. Okay, let's move on. So here we have Porphyromonas gingivalis because it was very important. It has a capsule which prevents opsonization. You know what is opsonization? Then there is fimbriae, which helps in attachment. Fimbriae of this bacteria helps in attachment. It has capsule which prevents opsonization by complement system and has anti-phagocytic activity. Of course, it will not allow it to engulf. And because it is gram-negative bacteria, then it must have LPS, lipopolysaccharide. Yes, lipopolysaccharide. Remember microbiology or lost it? And LPS, lipopolysaccharide, gram-negative bacteria, and then endotoxin inhibits chemotaxis and leukocytes. It has this defense mechanism, lipopolysaccharide, gram-negative bacteria, release endotoxin when on death, very dangerous, and inhibits chemotaxis and killing by leukocytosis, right? Defense mechanism, LPS. And enzymes, this bacteria produces enzymes. How you remember gingipains, collagenases, like Colgate toothpaste, you have, okay, gelatinases and hyaluronidase, right? So at least you remember these two, gingipains and collagenase. It's easy to remember. How to remember these? From gingiva, gingipains, and from Colgate, you use the toothpaste, collagenases. And these enzymes degrade the complement collagen. That's why collagenases, ases mean destructors, collagens, and gingipains mean pain in the gingiva. Perfect. Gingivitis. Enzyme degrade the complement collagen, connective tissue, ground substance, and immunoglobulin. Destroy periodontal tissues. What does it do? Is destroy periodontal tissues. How? By enzyme. What enzyme? Pain in the gingiva, gingipains, and destroy the connective tissue, collagenases. Okay, perfect. At least we remember some of them. This is another representation when in your gingival sulcus, when there is bacteria. This is a gram-negative bacteria. It has fimbriae. It has gram-negative bacteria, so it has lipopolysaccharide capsule, which helps to prevent opsonization and engulfing by the leukocytes. And because it is gram-negative, it will have endotoxin. It will release endotoxin and will cause, these endotoxin will cause chemotaxis of the inflammatory factors, pro-inflammatory cytokines, interleukin 8, 1 alpha, 1 beta, interleukin 6. 1 and 6 cause fever and chemotaxis. Okay, we need to revise those. So this is how it works. Let's quickly revise it. Periodontal disease, we know it's a chronic bacterial infection. It involves the structure of periodontium, breakdown of periodontium, leading to the cause of tooth loss, and is a leading cause of tooth loss in adults. Gums are involved, bony structure is involved, periodontium is involved, gaps are involved. What are gaps? These are the tissues of the periodontium. Gingiva, alveolar bone, periodontal ligament, C is cementum. And the chronic bacterial infection will be affecting these tissues known as periodontal tissues, periodontal diseases. Structure And then how it happens, when it happens, it can happen at any age, but most common in adults, because one of the most common diseases of the adults. How it initiates, plaque is formed. Then plaque, when not removed, will cause gingivitis, and still plaque build up will become hardened. It will hard and is known as calculus. And if it is slow, usually it is slow progressing from healthy to gingivitis to periodontitis to advanced periodontitis. Why we are studying gingivitis and periodontitis? Because periodontal disease, the two major forms of periodontal disease are gingivitis and periodontitis. That's why you're studying. So this is the progression of the periodontal disease. Usually it has slow progression, but in immunocompromised patient and patient with a comorbidity, it will be rapidly progressing, and it is changed and modified by local factors, systemic factors, stress, and smoking. And what were the gram-positive bacteria? ALS, actinomyces, lactobacillus, streptococci, ALS. All were what? All were facultative anaerobes. Lactobacillus and streptococcus had what in common? Produces lactic acid. Especially lactobacillus has a role in dentine. Why it is important to mention here? Because outermost layer is enamel. So enamel is done. Enamel caries are done. We have reached to the lower than enamel level, which is dentine, and lactobacillus is lactic producing facultative anaerobe, which has major role in dentine caries. And then we had streptococci, which also produces lactic acid. But there were some favorites: mutans mites, endocarditis, associated with caries, salivarius, saliva, tongue. Tongue has mucosal surface. This is mucosal surface. What were the other mucosal surface involving? Hair, angiosus, mucosal surface. So you see mutans mites, bacterial endocarditis, carditis, mutans mites, endocarditis. Also associated with periodontal disease, also associated with endocarditis. That's how you remember with relativity, right? Saliva on the tongue. Tongue has mucosal surface, so colonizes on mucosal surface and cause periodontal disease. What other strep species cause also grow on mucosal surface? Angiosus. But this is angio. This is individual, isolated. Iosus, isolated. Dental plaque and mucosal surface. At least you have remembered something, I hope. Gram-negative bacteria. 3 important. I don't want you to forget. Porphyromonas causes major periodontal pathogen. It's a major periodontal pathogen. Gingivalis. Porphyromonas gingivalis. Actinobacillus, aggressive. Actinobacillus, aggressive periodontitis. Treponema, acute necrotizing ulcerative gingivitis, ANUG, acute necrotizing ulcerative gingivitis. Porphyria, Porphyromonas gingivalis, capsule, gram-negative, has lipopolysaccharide, endotoxin. Fimbriae for attachment with the cells, enzymes, gingipains, pains in the gingiva, pains, gingipains, collagenizes, Colgate, remember Colgate toothpaste, collagenases, and gelatinases, hyaluronidase, we also know, and destroy periodontal. How these enzymes degrade the complement collagenases, and connective tissue. Okay. Another representation, how the bacteria is in the gingival sulcus causing periodontal disease, how it is attracting pro-inflammatory cytokine expression, which factors, interleukin 1A, 1B, 1 alpha, 1 beta, 6 fever factors, remember? And then this another who likes to review the bacteria. This is another presentation of bacteria involved or associated with the periodontal health and disease. Periodontal health. Yes, we have bacteria which are responsible for healthy periodontium. These are the bacteria which are responsible for our healthy or normal periodontium. But when these get excessive, they can also cause disease. These get, you know, Veronella, we have seen gram-negative bacteria previously. It was also causing disease if it is in excess. But in a healthy situation, in a healthy concentration, it keeps it healthy. Then gingivitis, important bacteria. Chronic periodontitis, these important bacteria. Aggressive, acute necrotizing ulcerative gingivitis. You remember this, right? What were it? Treponema. I don't want to forget this. I don't want you to forget this. Treponema, acute ulcerative necrotizing gingivitis. And then periodontal abscess. Perfect. This is type of plaque by location. Let's have some quick review. How many students are there? Because we have less time. Yes, please.
Sir, like sir, as you explained about like that necrotizing gingivitis caused by treponema. Sir, like sir, is this necrotizing gingivitis that is caused by the treponema? Sir, is it a part of the syphilis disease caused by treponema pallidum? Sir, is it separately targets this?
Maybe one of the infestations. Very good, very good. Yes. So treponema is not only one species, right? Treponema
Exactly,
has many species. Yes. So pallidum, you remember causing
syphilis.
Perfect. So syphilis. What is that? What is the treatment for syphilis?
So you've got multiple.
Penicillin G, sir.
Yes, penicillin G. Do not forget this. This is
the drug of
the
choice.
love of our yes. This is the love of our medical studies. Syphilis. Syphilis involved in syphilis disease is a special disease, the mother of disease. All parts body one stage. And maybe there's, but as we know, this group is important in causing acute periodontal condition. This group.
Excuse me, sir. Like sir, for syphilis, sir, we use penicillin G, but sir, for like